Hello everybody, welcome back to the Clinical Trials Guru. This is episode 203. Very special day here in the clinic. This is an unplanned podcast, but Chris and I were in the other room working, and then we hear a lot of laughter from this room. So we come here and say, this would be great. Everyone's in a good mood. Let's do a podcast. Everyone has an interesting story we're going to get into. And I think other people that are watching or listening are going to get some value out of this. So we're going to talk about clinical research careers, expectations, and then your backgrounds, which is really exciting. So let's go around.
Who wants to start?
Either way, yeah. We'll go like, who wants to go first? Just quick introduction, your background, who you are, and then we'll get into conversations after the intro.
Everybody's pointing towards you.
That's right, everyone knows.
Hi everyone, my name is Jackie Wallace. Been here a couple of days in the doing the internship. My background is I am retired military, retired military, 29 years in the Air Force. Civilian wise, I've been in banking and finance world for about the past 17 years. So whole new career, whole new direction for myself.
Okay.
Thank you. Next volunteer.
Yes, I'm Neba. I work for the FDA. I'm a nurse. But
That is scary.
Yes.
Get out of here, Neba.
I work as an analyst coder for the FDA.
We don't want you here, Neba. I forgot about that.
I'm planning to maybe run a site too someday.
That's cool.
If it's possible.
All jokes aside, that's actually good background. And RN.
Yes.
Okay, you did mention that, right?
Yes,
okay.
yes, I'm a nurse.
But the FDA might be even more important, actually.
You never know.
Chris needs an intro.
Hello, I'm Chris.
He's from the FDA.
You can move on. Keep going.
Hello, I'm Beatrice from Houston, Texas. I am a nurse as well. Chris has been very instrumental in my new interest into clinical research. It's been very fun. I am looking forward to bigger and better things. Hopefully start a career as a CRA, and then Kenneth and I will be partners.
We're on the side.
Right?
You'll be the study coordinator at my side.
That's a demotion.
Good, I like that.
Hi, my name is Helen Kasozi from Maryland, and I'm from real estate finance. I've been in the industry, real estate finance, for about 12 years and transitioned into clinical research, a whole new world, but I'm excited, and I thank Dan and Chris for helping us through this season of transitioning to the internship. Thank you.
Yeah, so everyone has a pretty good background. Lately I've been telling you guys there's been a lot of students that have been getting hired. So, and I haven't really gone through my thing with you guys, which we do Thursday and Friday. Chris hasn't even gone through his tomorrow. But what were your expectations? And you have a brother who's a CRA, right?
Yes.
So you probably, from everyone here, probably expectations were most grounded with reality as for a CRA. Because for most students, when they think of CRA, they don't really understand what that actually entails.
Right.
And they don't even understand what the industry entails. They don't realize there's literally 25 or more different job titles that are possible. Maybe even 50 or more, right? I mean,
I'd say close to 100.
Right. So there's dozens, if not hundreds, of different job titles, and everyone just thinks CRA.
Right.
Like I went to a UC yesterday, I won't say who, and they have like what we take for granted, what Carlos does here and Rosario does here, like literally they do everything. At that place, at the university, there are 20 people.
Right, it's compartmentalized.
There are 20 people
You
doing
have regulatory, you have somebody who probably just manages IP, right?
And someone just manages the person who manages the IP.
Right, it's ridiculous.
Right.
Well, I don't know ridiculous, but lots of different positions.
But that's yeah, exactly. So many positions, which is all opportunities for you guys. So yeah, what were your expectations going into the clinical research field?
Well, initially when I first heard about it, you hear the travel, this, that, and the other. So that was the initial interest. Obviously, income was obviously a selling point there also. But as I began to dive into it, take the class, that's when my brother began to open up and tell me more about it, and reading protocols and going through, looking at various information. So it paralleled my background as being in the mortgage business as an underwriter, where you're making sure all the I's are dotted, T's are crossed. So it kind of rolled, it fit in a sense. Mm-hmm. So that I understood early on. There's a lot of reading, there's a lot of writing, there's a lot of, just making sure, going back to what I said, making sure all the I's are dotted and T's are crossed, making sure people are doing what they're supposed to do.
Mm-hmm. Now let's go over here. So from the finance or the RN space, and then we're going to get into site ownership too, because that's very interesting.
FDA also.
Stop scaring me. I already forgot, and now you reminded me again. We'll get into the FDA too, because that's interesting as far as what you do. But so from the finance, like, what were your expectations of clinical research?
I had an idea of clinical research. My husband is in data management.
Oh, okay.
So I kind of had an idea of what it is, but not really the in-depth knowledge of what is needed.
Right.
But
because they're just in the. So we just had a student got hired as a data manager. Mm-hmm. They're very compartmentalized, like we were mm-hmm. talking earlier. Yeah. So there's very few generalists in the space. Everybody's sort of a specialist. Mm-hmm. What we try to do is make you a generalist, so you can apply for a wide variety of different positions. But so you knew a little bit about it from your husband, right?
But it wasn't as detailed as I'm seeing now and today, as we were it was really good, a good exercise.
So do you want to be a CRA still?
I'm not really a CRA. I don't mind doing regulatory affairs or something like. I'm more of an administrative person.
Yeah, we know a guy who does really well at regulatory affairs.
Yeah, so that's kind of where I'm looking into.
Okay. Yeah. And did you know that before the class?
No, I did not.
So you knew that because of the class?
Because of the class, yeah.
See? Mm-hmm. That's very common.
Mm-hmm.
Sure.
You think you want to be a CRA because that's the brand name.
Mm-hmm. Yeah, that's true play 75% of the students.
Yeah.
Once they complete the class, I don't know if I want to be a CRA.
Mm-hmm. Many say I want to be a site owner.
Mm-hmm. Right.
You know?
Right.
Like Mr. FDA right here.
Who's already got his coordinator.
He already
competitor.
Ooh.
Both start with a C though.
Sure.
No, but you're in Maryland. Yeah. You're in Maryland. Maryland and Houston. Yeah, no competing.
Oh, she could work remotely.
Sure.
That's funny. No wonder you guys are laughing so much. That's cool. All right, so let's get into the FDA. What do you do at the FDA?
I'm an analyst coder. I work on adverse events reporting for medical devices.
You're in the device department.
Yes, I'm in devices, but I'm a nurse. My background is nursing. Mm-hmm. So working on medical devices, we work on experimental devices too.
Yeah.
Trials on devices. And so my background is nursing. I was like, let me do something that's really on the side of nursing, not the devices. So I started getting interest in clinical research. I read online.
Yeah.
And my mind was set on CRA. Mm-hmm. But when I got here, met Chris, and I've met you today with the ideas I've gotten from here, what you've told us. That's why my ideas are evolving. That's not just being a CRA. You could do more than that.
The gears are moving. Because you get exposed to everything, right?
Yes.
Yeah, I think we've had a lot of students that took this class that went on to open sites. We actually partnered with one.
True.
And since I have some good partners here,
yeah,
study coordinator here.
You have partners and a competitor.
I guess he might be afraid of me. That's what it is.
He's afraid of me.
Man must be scared of me. Telling me things that
I'm like, really?
No, he knows better.
So how about you? We have another RN. How about you for your expectations, and then what the reality actually is for research, from your opinion?
Well, from the RN perspective, RMBSN perspective, I came prepared in that if you don't document it, it was not done. And so for that piece, I am ready. But the amount of work, it's a lot of work.
You'll see Thursday. That's nothing yet. Thursday, you'll see the report. I mean, and that's just like a Cliff Notes version of our report, not the full. The full report takes days to do. But you're gonna get the full report. We're gonna fast forward a lot of it, like a lot of the boring parts. Mm-hmm. But yeah, there's a lot of work. You're right.
So prerequisite-wise, I think that given that I have a science background, it comes to me easier to pick out some things on the medical side of clinical trials. Mm-hmm. So it will be a plus. Mm-hmm. But there are other challenges. I just do not want to come across like, it is cheese, it's easy. It is challenging in that you have to be task-orientated. You have to be very detailed. You have to stay on point. Otherwise, you make major mistakes that could cost a lot of money for the sponsor. So on that front, I'm not yet where I need to be.
Yeah.
But I'm in the right place. And my mind frame is good. I know this is doable. The exams have done well. I am picking on, so I am looking.
Oh yeah, you guys took the final exam.
Yes.
You didn't have a final. You got lucky. Because the class after yours, we started doing final exam.
Well,
I had a final.
Oh yeah, that's right. Sorry. No, they did.
Yeah.
You had a written final. We made it like a tough one,
okay.
Like a super tough one. You guys got good grades?
Yeah.
That's good. Yeah. I think the highest person was 89%.
Oh really?
Yeah, she came 2 weeks ago, right? Was it 2 weeks ago? Yeah. Okay.
So I was close to that.
Yeah?
Yes.
I think the average is like around there.
Yeah.
Yeah, it's close to that.
We
83.
We only had a few fail, like just a few. From your class too, just a couple.
A couple that did what did not do well?
Yeah, like if they didn't get a certain grade on it.
So did they retake?
Did they?
Everybody that failed was allowed to retake it. Just this quarter. Just this quarter. That's not going to be the way it's because it was the first time that we administered.
And you know we got to redo the questions because Vince and Amy are using them as quiz questions now.
Really?
Yeah.
Wow.
I know. More work.
Well, I noticed there was one in the most recent quiz from the final.
I noticed
I don't think they're using all of them.
Okay, so they're not cherry picking.
I think they're just using one or two
for each
quiz,
good.
which is okay.
So what are your goals? What are your goals for research? Let's start here and just go around. Like next 3 months and then next 3 years.
Well, next 3 months is to be in the industry, working as a CRA. Next 3 years is on the research facility. Clinic.
Oh, another owner.
No way. There's no way I would not be in this industry that long and not work, not push to own the clinic, on the research facility.
Wow. Look at that. Inspiring new site owners. And you would have never known that prior to the CRA Academy, or you did?
I would not have known that by watching your videos.
Okay.
Yeah, the CRA Academy portion of it was classroom work, but just watching videos is when I began to, you know what, there's ownership sitting out there. Okay.
There is ownership. There's so many CRAs that have been doing this for so long that go to own sites. And so, we break it down, like the CRA Academy is learning how to work in your business, and then the Site Owner Academy is how to work on your business. So it's like you just combine those two because you're going to initially be the one working in your business at first to bootstrap. But, the margins are almost 100%.
Okay.
It's just what you pay the PI and what you can negotiate for the rent and things like that. But very little overhead.
Well, that's the next.
I did not know that. Glad I asked. That's why we do these interviews. Podcasts.
That's the next class conversation.
So site owner. And regulatory affairs.
FDA reg. That's where I want to go. Yeah, I want to go FDA regulatory.
Hey, when you start your site, she can take your job.
Sure.
Yeah.
Out of curiosity,
I'll let you know when I'm leaving.
Out of curiosity, Neva, have you ever thought of FDA auditor?
No, I've never thought of that.
Do you know any FDA auditors?
For the moment, no.
No?
No.
I know a former FDA auditor, Pat Stone. I mean, it's an interesting interview with that guy. Mm-hmm. Now he's a consultant, makes a lot more.
Sure.
But yeah. So what about you? 3 months, 3 years?
Yes, to get myself into the industry.
But you kind of are, but not full, like
yes.
not on the clinical side.
That's why I didn't say get my foot, but get myself into it.
Okay.
Now. And I will evolve from there. In the next 3 years, I wouldn't be I don't see myself just being a CRA.
Yeah.
When I get in, I should make a business out of it.
That's right.
Yeah.
Okay.
I'm curious, Pat Stone.
Pat Stone, yeah.
Do you know his background before being an FDA auditor? Was he in the business prior?
I think he was like a teacher.
So he could potentially be an FDA auditor. Right?
Oh yeah, he's already
there.
3/4 of the way there.
Right, and if you're an FDA auditor for a year, you could always become a CRA after that.
Oh, CRAs will love. I mean, CROs.
I'm just saying, that's another thought for you.
Mm-hmm.
Yeah.
Start working maybe where you're currently at to become an FDA auditor.
Yeah, ask him if you could be an auditor.
Yeah.
For sites.
And I guarantee you get a job as a CRA.
Yeah, tell them you did the CRA Academy, but don't mention my name.
I'll sit down and
don't
more business.
Just look over his YouTube video.
None whatsoever. No.
Give them your competitors. Too funny. Okay, Chris? Well, do you have questions, or we just go 3 months, 3 years?
Yeah.
Okay. You want to add it? You didn't want to add anything?
No.
Okay. 3 months, 3 years?
Yeah, about that's a good stream. We've talked.
Yeah.
3 of us have talked about it a little bit.
I can't believe 3 site owners coming up.
Yeah.
That's
We've
good.
talked about it, and we've wondered. I mean, it's difficult to not bring the risk part of things when these types of opportunities come up.
Mm-hmm.
You know, so I'll ask you straight up. So it's not an if we're going to do this, but what are the feasibilities of us doing this, and what are the roadblocks we should envision?
I mean, this is what Chris and I, when we talk to clients, potential clients, literally every day, the first roadblock is getting that first PI, getting that first physician to agree to want to do research with you. That's by far the first, because without that PI, you can't apply for studies.
Yeah, you have no business.
Now the next challenge is, okay, you're going to get that PI excited. He's going to say, yeah, great. And then months will go by with no activity, and that PI either forgot about you or thinks that you're all talk, right? But they don't realize that it's a slow process. So that's the next challenge. You got to communicate this with the PI. Here's what I did this week. I applied to these studies for you. I like to over-communicate with them, because then they see at least I'm doing something, right? If you could be working really hard to find studies, but if you don't communicate that, they will assume you're not doing anything, right? Or maybe you're trying to talk to the 100 more PIs and he's not important. So that's really the next challenge. I mean, what else? This is pretty much the 2 big ones early on, but of course there's money too.
Yeah, so first you have to build them up, and then you have to diminish expectations, right? First you get them on board, then you tell them, but understand this is going to take a while, right? And then like Dan said, over-communicate. So, I mean, that's what Dan does.
And the next challenge is the financing it, right? You can negotiate no rent if your PI has a private practice, and you can pay them a higher percentage of the budget in exchange for no rent, right? But then you've got your own living expenses, and if you're dedicated full-time to your own job, your own business, you're going at least 9 months with no income. At least. Could be longer. But usually it's 9 months. It takes about 3 months to get a study, 3 months to get started on that study, and then 3 months to get paid on that work. So that first 9 months is tough. People like to quit. Yeah, they're not prepared. They panic after the first 3 months. There's no study. It's like you're only 1/3 of the way there. So that's the main challenges. It's possible to continue your job and do this during this initial phase at the same time. All the CRAs that we talked about that have sites, most of them still have their CRA job, because the clinic doesn't require them to quit their job yet, or it can't support them.
And they make enough money where they can hire a coordinator.
Yeah.
To manage it, take care of it. Whereas a lot of positions, whatever career path you've chosen, you don't make enough money to do that. So it's nice.
3 months, 3 years?
3 months, 3 years. Reg affairs, 3 years. I'll consider being an FD auditor.
Ah,
That's something that I wouldn't mind.
lose my number.
Don't come knocking on my door.
Yeah, that's
keep
cool.
his number and give him a warning when one's coming.
I'll just forward it to Chris as well.
Right, alternative perspective.
Really? So FDA auditor?
Yeah, I like that, aspect of stuff. Very diligent.
You like burning sites down.
Yeah, yeah.
So the interesting thing is FDA auditors, they don't actually get paid nearly as much as CRAs. I mean, it's not even close. But you're pretty much doing the same thing. So it depends on what you enjoy doing more of. Because with the CRA, you're obviously working more with the sponsor and the CRO, and even with the site. As the FDA, you're just looking for...
Yeah.
But you're a government employee as an FDA auditor.
Sure.
You probably don't work nearly as hard.
No, you don't.
hard,
It's
yeah.
hard. No.
You're not putting in the same hours.
And you're not traveling that often.
Well, I mean, you travel, but
Not as often.
right,
And they're understaffed, so they don't even audit that often.
right.
After this video, they might. That's good. Anything else? Closing thoughts, remarks, comments,
Just
questions
want
from
to-
Chris?
I don't think I have any questions. Just to thank Chris, just to thank you, Dan, for the great job you're doing here.
Thank you.
And we hope we'll spread the word and many people will be calling your numbers and coming for training.
That's
Trust me.
I already recommended. My cousin's already in the class, and more
Really?
people are coming. Yeah.
Okay, good.
So
Good,
you're
good, good.
going to see more people.
Thank you.
Appreciate your input, and the YouTube videos are also very helpful. And
Thank
very
you. We're adding one more right now.
For me, I enjoy your sincerity. You're very sincere. You tell it as is. I like the fact that you're also extremely supportive with the videos. I've not been able to watch as much as I should, but I will watch. So the academy, Chris too, and you, and Shanae, and the rest of
Shanae.
everybody else. So
Vincent,
it's Vincent. It's a big shout out.
Brenda.
Brenda,
Vince is an unsung hero.
Dora,
Dora,
Dora.
Amy.
Amy, just everybody.
Yeah, so it's a good team. Thank you very much.
Thank you,
both of
guys.
And Julie.
Closing questions? You love
Julie,
the
we
closing
always
questions.
get those
Julie
emails.
too,
Oh,
yeah.
Julie, yeah.
She's
get
very
those-
diligent with the
Yeah.
Get
email.
those CVs
We-
to me.
Yeah.
Yeah, we always get emails from Julie. Sometimes get up in the morning, I see an email from Julie. But okay.
I don't mean
Yeah.
to sound like a broken record, but I agree with everything with what you guys have just said. It's been hugely advantageous to go through this class and to be in a position to come out here and sit and actually hands-on,
Yeah.
A lot of people, some people, they learn by just being on the computer. I'm literally not that guy. I'm literally hands-on. Let me see it, let me touch it, let me smell it, and I'll work with it. I'll figure it out from there. So this is hugely advantageous for the way my personality
Thank you. Yeah.
works. And I met some cool people already too.
Yeah.
That side of it,
This is a good group.
And Chris too.
We're out there. Chris planned it for 4 people. I was upset at first, but it worked out well, Chris. That's fantastic.
You'll just be crammed like sardines come Thursday.
I'm up to
Yeah,
2 and
space
2.
is
I already
much
figured
smaller.
2 and 2, and we're gonna switch between me and Monica. It'll work out. I'll do 2 presentations that day. Yeah, I mean, we're playing the long game. Like, the difference between us and the competitors is, like, for you guys to be site owners, for you to be in the industry, like Chris and I, we're not going anywhere, God willing. We'd like to draw upon you guys' support at some point too. So it's not like we're Mother Teresa, but we understand that giving the value up front, we can get it in return too. And it pays
Exactly.
off way down the road.
Exactly.
Could be 2028.
You never know, but I mean, you get it back. You give it
Yes.
out there, and it comes back to you in one way, shape, or form.
Well,
So-
good luck. We've got 3 more days, and then we'll do the CVs. And like I said, you guys will start getting the job interviews very soon. So thank you guys. Thank you, everybody.
Appreciate you.
Thank you.
Take care.
Thank you. Appreciate